Welcome to The Explainer, where we break down the big topics. For more than a decade now, there's been this one phrase that you just can't escape in American politics: repeal and replace. So today, we're going to dig in and figure out what that really means for all of us.
Yeah, this phrase has been a central promise for, well, a long time. But what does repeal and replace actually look like when the rubber hits the road? It's not just one simple plan. It's really a whole menu of different ideas, and every single one of them comes with some pretty massive consequences.
Okay, so to really get our heads around this whole debate, we got to start with that first word, repeal. You might think, oh, just get rid of the law. But it's not like flipping a switch. It's more like carefully dismantling a giant, complicated machine piece by piece. So let's take a look at what that actually involves. All right, first up, what does repeal actually mean? It's way more than just wiping a law off the books. We're talking about taking out some of the core pillars of the healthcare system that we've had for over a decade now.
So, when you hear politicians talking about repeal, these are the big things on the chopping block. We're talking about the financial help that millions of people rely on to buy their insurance. We're talking about the Medicaid expansion that covered, over 20 million people? And then there's the big one, maybe the most famous part, the rule that says insurance companies can't just deny you coverage because you have a pre-existing condition.
And let's be clear, this fight is not new. Since the day the ACA was passed, there have been nonstop attempts to tear it down. We're talking over 50 times. The closest it ever came was back in 2017, when some major bills came this close to passing, but just fell short. So yeah, this debate has been a constant drumbeat in American politics for a long, long time. Okay, so that's the repeal side of things. Let's move on to part two, the replace ideas. If you get rid of the current system, you have to put something in its place, right? So let's look at the main proposals that always seem to come up. Okay, one of the biggest pieces in a lot of these replacement plans is changing how Medicaid gets its money. The main idea is to switch over to something called block grants. Think of it like this. Instead of the federal government matching state spending dollar for dollar, it would just hand each state a big lump sum of cash for the whole year. So what's the trade-off? Well, states get a lot more freedom to run the program their way, but they're stuck with that fixed budget. If healthcare costs spike or a recession hits and more people need help, that money might not stretch far enough.
All right, another really common idea you'll hear is letting insurance companies sell their plans across state lines. The thinking behind it is pretty simple: more competition equals lower prices. The hope is that if an insurer from a state with, say, fewer regulations can sell its plans anywhere, it'll create this big national marketplace and drive down costs for everyone. Then there's the idea of changing how the government helps you pay for insurance. So instead of the ACA's system, where you get those subsidies up front to lower your monthly bill, this proposal would give you a tax deduction. Basically, if you buy your own insurance, you could deduct the entire cost of your premiums from your income when you file your taxes. The goal is to lower your total tax bill at the end of the year. And this is where things get really interesting, because you can see a huge difference in who gets the most help. The ACA's tax credits are means tested. That's just a fancy way of saying the less you make, the more help you get. And you get that help right away, every month. A tax deduction, though, well, that works differently. It tends to give a bigger financial boost to people in higher tax brackets. So the bottom line is, these are two very different ways of helping people, and they point that help in totally opposite directions.
Okay, so those are the main ideas on the replace side of the coin. Now, let's get to the big question in part three. What would all of this actually do? What would the impact be? Let's dive into the numbers and see what the models project.
One of the big studies on this, from the Commonwealth Fund, projected a pretty major drop in the number of Americans with health insurance. Just a full repeal all by itself was projected to leave almost 20 million more people completely uninsured. That's a huge number.
And that number gets even bigger. When you add in the Medicaid block grants we talked about, the projection jumps to over 25 million people losing their coverage. So why such a big jump? Well, the analysis figures that with a fixed pot of money from the federal government, states just wouldn't have enough to cover everyone who qualifies today. They'd basically be forced to make some tough cuts. It's not just about who has insurance, it's also about the cost. And the same analysis looked at that too. The projections were, pretty stark. For people buying insurance on their own, their average out-of-pocket costs, that's everything you pay, right? Your premiums, deductibles, all of it, were projected to climb a lot. especially under that selling across state lines scenario. So, you're probably asking, why would costs go up so much? The thinking in these models is that selling insurance across state lines would lead to a flood of what you could call bare bones plans. The kind with a really low sticker price, a cheap monthly premium, but a sky-high deductible. It means you're paying less each month, but if you actually get sick and need to use it, you're on the hook for a lot more money. And this next point is absolutely crucial. The projections show a massive spike in the number of uninsured people who are already sick, people in fair or poor health. Without the protections that are in place now, the fear is that we go back to a time where it was incredibly difficult or just way too expensive for anyone with a pre-existing condition to get coverage. And that's really what's behind this startling number. When you step back and look at all these policies and all these numbers, you start to see they're all pointing to something much bigger. So for our last section, let's zoom out, because this isn't just a debate about policy details. It's really a clash between two completely different ways of thinking about healthcare itself and what its role should be in our society. And this chart really lays out that core philosophical divide perfectly. On the one hand, you have the approach of the ACA, which is all about federal rules, minimum standards, and helping people based on their income, a vision of collective security. On the other hand, you have this alternative vision. This one is all about giving states more control, letting market competition drive things, and really emphasizing individual choice and personal responsibility. But here's a fascinating twist in the story. The conversation itself seems to be changing. More recent reports are suggesting that the whole political focus might be shifting away from scrap it and start over. Instead, the momentum seems to be building around making major reforms to the system we already have. It kind of feels like a new chapter in this whole debate. So at the end of the day, this entire massive debate really boils down to one fundamental question. What is the right balance? How do we weigh individual choice and market freedom against the idea of collective security for everybody, especially for the people who need it most? There is no easy answer here. And how we as a country decide to answer that question, well, that's going to shape the future of American healthcare for years to come.